and subscapularis. Okay. Before, I'm not sure kung na-explain ko na sa inyo with regards to the skull. If you're given a particular structure and you're going to name a structure with regards to that structure, you call it supra or infra. But when you're discussing a structure in relation to space lang, you just call it superior or inferior. Example, you have your orbit, supraorbital or infraorbital. If you have your fissures, superior orbital fissure, inferior orbital fissure. So here, looking at this, you have this, what do you call this? It's called the spine of your scapula. So what do you call the muscle above the spine of the scapula? Supraspinatus. Below it, infraspinatus. And underneath the entire scapula is the subscapularis. Okay? Teres minor is also attached to the inferior-most portion. Okay? So teres minor. Teres major is not included sa rotator cuff muscles because it inserts near the area where your latissimus dorsi inserts. So basically, if I cut the latissimus dorsi or if I throw away the latissimus dorsi, the teres major will take over with the same function as the latissimus dorsi. If I have yung pectoralis major and I discard the pectoralis major, the pectoralis minor will take over. So that's how you study it. So you would know the origin, the insertion, and the action. Basically, if you know the origin and the insertion, you would know the action. Origin is a fixed point. The insertion, it's being drawn to that when the muscle contracts. So if you know the origin, you know the insertion, you would know the action. Okay, so ngayon, looking at the back, you have superficial muscles not involved in the arm. You have your trapezius. Yan, diba? It's diamond shape. Okay? And you have your latissimus dorsi. Ang marker nyo for the latissimus dorsi, it has a horizontal component, diba? Going to the arm, and galing sa baba, going up. Horizontal, going up. Your mark would be your scapula. The tip of the scapula, yan ang horizontal component ng latissimus dorsi mo. Okay. Your trapezius would overlap the medial aspect of the latissimus dorsi, the origin, yan ah. So it goes down, yung trapezius mo, yan, goes down, lumampas siya. So you should elevate the trapezius. Yan, that's still the trapezius, diba, yung mahabang thing na yan. When you elevate the trapezius, you would see the medial border of the scapula, which has two muscles, shaped like a rhombus. So it's rhomboids. The bigger one is the rhomboids major, the smaller one is the rhomboids minor. Diba? Here, this is your rhomboids major, rhomboids minor. Diba? Okay. So basically, alam mo na, you have your supraspinatus, infraspinatus, teres minor, and the teres major. Diba? Sa medial aspect, you have your rhomboids major, rhomboids minor. Pinaka-superficial, you have your latissimus dorsi and your trapezius. Okay, that's the back, di ba? From the anterior, the muscles that you're going to look for are the pectoralis major. Underneath is the pectoralis minor. Underneath the clavicle is your subclavius, di ba? At the lateral most portion, the one covering this entire area, you have your deltoid. Okay, the word seps means belly. And when you hear the word brachii, you're referring to the humeral area, humerus. So, nandun yung brachial plexus, di ba? You have your biceps brachii, triceps brachii, di ba? Your coraco brachialis, and the brachialis. So basically, when asked, what are the muscles that extend your elbow? You have the triceps. Triceps, 3 bellies. Diba? Biceps brachii, 2 bellies. So what flexes the elbow? It's the brachialis, not the biceps. Okay? The biceps, secondary function lang niya ang flexion. Primary function is externally rotate. So if you're doing weights, you don't do this to develop your muscles sa biceps. You do this. Otherwise, you'd be exercising your brachialis. Okay? So pag ganon, externally. So you already know two of the muscles, di ba? Brachialis and brachialis and the biceps. The coracobrachialis, the coraco meaning scapula, going into the brachialis. So from the name lang, you know the origin and the insertion eh. Diba? So, knowing that, you have three muscles here, brachialis, biceps, coracobrachialis. Sa likod, only one, triceps. Sa chest, pec major, pec minor, subclavius. What do you call the muscle na naka-interdigitate sa pectoralis mo? Yung kay Manny Pacquiao, yung maganda. It's called serratus anterior. That's the reason kaya nagkakaroon kayo ng side stitch whenever you're running. Kasi if you're going to follow the axillary artery, the third, how many parts yung axillary artery? 3. The third part has 3 parts then. Diba? You have your anterior and posterior circumflex and the subscapularis. The subscapularis gives a branch to the latissimus dorsi called the thoracodorsal, and you have another branch going to your serratus. Since it's the terminal branch, if you're running, all your blood will go to your lower extremities. Mawawalan ka ng blood dito. Shunting eh. So if you don't have blood to that area, you have partial ischemia or temporary ischemia, yun yung side stitch nyo whenever you're running. Okay, so yun yung serratus mo. The function of your serratus is to hold the scapula in place. Kasi you can see the serratus here, pero it's from the scapula. So if you have a non-functional serratus anterior, your scapula will wing. Nakita na kayong tiger? Di ba pag nakaganon yung tiger, nakaganon yung scapula nila? Yun yun. So if you have a ligated long thoracic artery, you will have a non-functional serratus anterior, which will give you winging of the scapula. Why is that important? Kasi diniscuss nyo yung axillary area. One of the nerves na nasa-sacrifice, pag tinamaan, dapat you shouldn't pag tinamaan, is the long thoracic. Okay, so discuss natin. So basically, you now know the muscles, you know the origin, the insertion, and the action. Let's describe the vessels. So, to make things complicated, one structure is named differently depending on the area you find it. So, the same artery you find underneath the clavicle, you call it the subclavian artery, is the same artery you find here, but this time you call it the axillary artery. And as you cross the teres major, the axillary artery becomes the brachial artery. Okay, so for your purposes, ang kailangan yung malaman is the axillary artery, which is divided into 3 parts. One is above the insertion of the pectoralis minor. One is beneath the pectoralis minor. One is below the pectoralis minor. Okay? So, above, beneath, below. First part, second part, third part. 1, 2, 3. 1 branch, 2 branches, 3 branches. So, dun sa 1, since it's only 1, and it's the highest, it's called the supreme or highest thoracic artery. The second branch has 2 parts, thoracoacromial and lateral thoracic. So how will you remember that? The thoracoacromial artery is the major blood supply to your pectoralis major. Siya yung nakita nyo na kinat nyo dito sa clavicle. Pag kinaas nyo yung pectoralis, may nakita kayong vessel na gano'n eh. Dito sa ilalim. That's your thoracoacromial artery, which is the major blood supply of your pectoralis major. The lateral thoracic artery is the minor blood supply to your breast. The major is the internal mammary. So it's the minor. So you would see na kung nandito, thoracoacromial mo, nandito yung lateral thoracic mo. Yun yung sa second part. The third part, dito na yun. So you have to have an artery supplying this area, going around it. That's why you call it circumflex. One is anterior, one is posterior. Pero they're connected. Anterior circumflex, posterior circumflex, and you have a third branch going to your scapula. So you call it, hindi ka papatong sa ibabaw ng scapula. You call it subscapular. So subscapular branch or subscapular artery. So yan, the review. First branch, supreme or highest, kahit alin pwede doon. Second branch, 2 branches. What are the 2 branches? Romial and? Okay. Third branch, 3 branches. Anterior and posterior circumflex and okay, the subscapular will give rise to an artery which supplies the latissimus dorsi. What artery is that? Thoracodorsal artery. So itsura niya from the third branch going to the posterior subscapular artery, giving a branch to your thoracodorsal, giving a branch to your serratus anterior.